Okay, guys, so here's the second podcast for this week, the skeletal system. And yes, this is like, all the bones, and some of the ones that you're gonna need to know the names of. So the first thing to know is you actually have two different divisions of the skeleton, because of course, why would we want to make things easy? The axial skeleton, that's the central part, the supporting part, that's like the middle. And then the appendicular skeleton, that's the bones of the limbs, the pelvis, and the shoulder area. So the appendages. Here in this picture, the axial skeleton is white, and the appendicular skeleton is pictured in blue. The adult skeleton has 206 bones. 80 of those are in the axial skeleton, and then the rest, the 126, are in the appendicular skeleton. Surfaces of these bones have surface markings, ridges, depression, bumps, projections, things like that, that provide routes for blood vessels and nerves. They serve as places for muscles to attach and areas for joint formation. When muscles come together to form a joint, we say they articulate. So I'm going to be saying bones articulate with things, and that's really where the joint is. You're not going to need to know the names for all the surface markings for the bones. It's just way too much. Just know that they're there. And if you're going to go on into orthopedics, then you're going to need to learn them there. So let's start with the skull. The bones of the skull, and they're fused together by the time we reach adulthood. The frontal bone right here, the parietal bone, occipital, temporal, sphenoid, I love saying that word, and ethmoid bone. And then here are the parts of the ears. I'm not really going to expect you to know that. It's a good idea to learn these now and where they are in your skull, because they're going to coincide with the lobes of the brain when we get to the nervous system. Suture lines, I'm just showing you this so you can see that there are suture lines, like this coronal suture right here, the sagittal suture. Sagittal, remember when we learned directional terms, and sagittal was one of the planes that split the body in half, right and left. That's why this is a sagittal. The lambdoid suture back here separates the occipital bone from the parietal bones. Again, I'm not going to expect you to know the names of these sutures, but know that they're there, and you should even be able to figure them out just because you already know directional terms. Facial bones. These, I always used to think that we only had like 3 bones in our skull, but really, and these bones are really all fused together. The zygomatic bone here, that's really like the cheek. And you have one on each side. Lacrimal bone, and when we get to senses, you're going to learn the lacrimal duct is where the tears drain. And it's right here as part of the eye. So that's the lacrimal bone, and again, there's one on each side. Nasal bone, that's kind of obvious. That's the nose. And you really only have a bone for the top part of your nose, the bridge of your nose. The other part that protrudes out, that we all say gets so big, that's really cartilage. The maxilla, this is the upper jaw, and then the mandible is the lower jaw. The inferior nasal concha, or concha, I guess, I'm not really sure how you want to describe that. It's a portion of the nasal bone. They contribute to the nasal cavity, and it's really all I want you to know about that. Paranasal sinuses, these are really openings. They're filled with air. They open into the internal nose. They lighten the skull. They act as resonators for sound production. They're named for the bones that they are a part of. So the frontal, the maxillary, the ethmoid sinuses, and those ones have pretty well-defined shapes. The sphenoid sinuses are like sinus cells. They have kind of a honeycomb shape. So the vertebral column, or vertebral column, I like to say vertebral, I don't know why. You have 33 vertebrae, and this is really what holds your head and your torso upright. It serves as an attachment point for the legs. It encases the spinal cord, and it's what allows you to bend forward, backwards, and sideways. There are 5 main sections. The cervical section right here, C1 through C7, that's the first 7 vertebrae. There are 12 thoracic vertebrae, and if you remember your body cavities, this is the thoracic body cavity, where the lungs are. The lumbar vertebrae are right here, the lower part of your back, and there's 5 of those. The sacrum is really 5 fused vertebrae, and then the coccyx, which is 4 fused vertebrae. There are normal curvatures of the spine, so even if you stand up perfectly straight, you're going to have a little bit of a curve. I am going to expect you to know the different sections, cervical, thoracic, lumbar, sacral, and coccyx, and how many vertebrae are in each one. We're talking about vertebrae. These are the irregularly shaped bones. Their structure differs a little bit depending on where they are, but there are some things that they all have in common. For example, the vertebral foramen, this opening right here, that's the opening that your spinal cord passes through. The body is this whole part here. That's really the part that bears weight of the vertebrae. The spinous process, that projects posteriorly, so towards the back. That's this right here from the vertebrae. Well, if you run your hand along your spine, this is actually what you're feeling, is this spinous process. And then the transverse process, they extend from each side of the vertebrae. These ones right here. There's one on each side. These are really attachment points for muscles and ligaments. In between each vertebrae are discs designed to support the weight and absorb some shock, a lot like cartilage in your joints. It consists of a core that's kind of a gel. And then the outer part is really kind of a fibrocartilage type thing. A sudden intense pressure on these discs, like when you lift something heavy or you injure yourself somehow, this part here, this fiber thing, develops a crack, and then this gel leaks out, and that's what we call a herniated disc. There are 2 specialty vertebrae, atlas and axis. The atlas is C1. You can tell it really doesn't have a body per se. It's really kind of a delicate little ring. There are depressions on each side, right here and right here. These articulate with the bony projections from the occipital bone of the skull. And this is what allows your head to move back and forth, like when you nod yes. I don't know if back and forth or forward and backward is really the better way to put that. But that's what allows that to happen. And then the axis, C2, so that's your second cervical vertebrae, has a projection called the dens, right here, also known as the odontoid process. This projects into the atlas, and it's what allows your head to swivel from side to side, like when you say no, or shake your head no, or shake the spider webs out of your head in the morning when you first wake up. There is a ligament right here, this transverse ligament that holds the dens in place. This is really the atlas and the axis together. And again, this is what allows your head to swivel back and forth, like what this is saying. The bony projections from the occipital bone rest here, and that's what allows you to nod your head forward and backwards. A hard blow to the top of the head can drive the dens through the foramen magnum and into the brainstem, which would result in sudden death. Isn't that a happy thought? Okay, the thoracic cage, remember the thoracic region of your body is where your lungs are, so the thoracic cage really consists of the thoracic vertebrae in the back, and then the ribs and the sternum. These are what surround and protect the heart and lungs. And they also provide an attachment point for the pectoral girdle, or the shoulder, and the upper limbs we're going to talk about next. The sternum, also I think commonly known as the breastbone, actually has 3 parts to it. Most of us don't really think about it. The manubrium, which is right up here at the top, that's the widest part of it. And then the body of it is the largest part of the sternum. And then the very bottom part, the xiphoid process. That's the landmark that you find when you're getting ready to do CPR. The ribs, there are 12 pairs. So you have actually 24 ribs, but 12 pairs. Don't be fooled by that on a test in a question. 1 to 7 are called true ribs. So these ones all right here are called true ribs because they attach directly to the sternum with some cartilage. Pairs number 8, 9, and 10, these ones here, are called false ribs. And 11 and 12 are also called false ribs because they attach to cartilage that attaches to another piece of cartilage that attaches to the xiphoid process. 11 and 12 are also known as floating ribs because they don't attach to any part of the anterior thoracic cage. So that's important to know, the true ribs and the floating ribs. The upper limb, I just mentioned the pectoral girdle or the shoulder girdle. That supports the arm. It consists of the clavicle, which is the collarbone, and the scapula, which is the shoulder blade. The one key landmark I want you to know on this shoulder blade is the acromion process. That's a landmark that you're going to find when you learn how to give IM injections. The rest of the coracoid process, I don't really think you need to know at this point. The humerus is the long bone of the arm right here, or the upper arm. The enlarged end of it is called the head. The head of the humerus is covered with articular cartilage, and that articulates with the cavity of the shoulder blade. And we're going to learn about what type of joint that is in the next podcast. The radius is one of the two bones of the lower arm, right down here, the radius. That's the one on the side of the thumb. You're going to learn about taking a radial pulse, and that's one way to remember where the radius is. The ulna is the other bone of the lower arm. It's longer than the radius. I'm not really sure why. I think it's just the way that worked out. The hand. There are 8 carpal bones, 2 rows of 4 bones that form the wrist right here. I remember watching a Law and Order episode where the actor who was playing the coroner had an x-ray up on the screen, and the character was saying, now look at these 9 bones of the carpal of the wrist joints. Look at these 9 carpal bones. And I thought, wait a minute, there's only 8 carpal bones. So just proof that those things are really strictly for entertainment, not really anything else. Anyway, carpal bones in the wrist. Metacarpals are the ones that form like the palm of the hand. And then the phalanges are also the fingers. These are all phalanges. So the fingers, and you'll notice the thumb has 2 bones in there. All the rest of them have 3. They are, we identify those as the phalanges are Roman numerals 1 through 5, 1 being the thumb, 5 being the pinky. It's really how they identify the bones. So if you hear a fracture of carpal, hand phalange number 3, you'll know which bone that they're talking about. The pelvic girdle. There are actually 2 bones that form the hip. The 2 large bones of the hip is called an os coxae, C-O-X-A-E. Also might be called a coxal bone, C-O-X-A-L. Together they form the pelvic girdle, and they're really the foundation of the pelvis. Each os coxae, and then if you consider this is really what that is, you have 3 bones fused together. The ilium, which we commonly refer to as the hip bone. The pubis is in the middle, and then the ischium is this very bottom part. These 2 you can see fused together at the symphysis pubis. And then in the back, it's not really pictured here, in the back, posteriorly, each os coxae articulates with the sacrum at the sacroiliac joint. Here's a lateral view of the os coxae. It kind of shows a few more things. The key landmarks are the iliac crest. That's this upper outer edge, and you may be trying to find that when you find landmarks again for giving IM injections. The acetabulum, that's the depression where the femur articulates into. It's one of those things that for some reason I can remember really easily. I can't really tell you why. The other ones you don't really, it's not really important for you to know at this point. Again, if you're going on to orthopedics, it's something that you're going to need to know. The femur. The femur is actually the longest and the strongest bone in the body. It articulates with the acetabulum of the pelvis. It forms a ball and socket joint. We're going to be talking about those shortly. The head of the femur fits very well into that rounded contour of the acetabulum. The neck of the femur actually is where when we hear about elderly people who fall and break their hip, they're not breaking their hip. They're not breaking their pelvis here. They're breaking their femur, the neck of the femur right here. That's where a lot of the fractures happen. There is a greater and lesser trochanter of the femur. That's attachment points for hip muscles. And then the medial and lateral epicondyles down here at the distal end of the femur, that's where the knee is. Tibia and fibula are the two bones in the lower part of the leg. Of the two bones, the tibia is the only one that bears any weight. So this is the only one that bears any weight. The fibula is here to provide a little structure. It also helps to stabilize the ankle. This part here is what articulates with the bottom of the femur. You can see the patella or the kneecap right there. The head of the fibula up here articulates with the tibia. So again, the fibula does not bear weight, the tibia does. And the bottom here, the distal end of the fibula, right here, is what forms the lateral malleolus of the ankle. I think that's probably the most common fracture site for an ankle fracture. The medial malleolus of the tibia is the other side of your ankle. And then last but not least, the foot. In the foot we have the tarsal bones, and I remember tarsal versus carpal because tarsal and toes both start with T. That's just the way that I help to keep them straight. Tarsal bones comprise the ankle. They do have names. I'm not going to expect you to know them. Just remember that there are 8 of them. Just like in the wrist, there are 8 bones in the wrist. There's 8 tarsal bones in the ankle. The metatarsals forms the flat part of your foot or the top of your foot. And then the phalanges form the toes. So you have phalanges in your toes and phalanges in your foot. And that's how I keep straight, because if you say phalanges, you need to know, are you talking foot or hand? So that's why I remember toes and tarsals and wrist and carpals. And that's it for this one. Next, we're going to talk about some joints. It's the next podcast, hopefully pretty short.